Stu, you had mentioned, how do we change this? My experience as a psychologist, and we talked a lot about change, right? How do you help people facilitate change in their lives? Because it is hard to change. We're creatures of habit. We tend to kind of keep doing things the way that we're doing them, and then adjust our ability to tolerate the pain that it creates, as opposed to changing our behavior. I have observed and experienced in my career and in my life that the way that people change is by having new experiences. We can talk about this until we're blue in the face. We can give people information until they're flooded and overwhelmed, but how do they actually do something with that information? That's why I think connection is so important, and supporting and finding people that are in the same experience as you, and then having a new experience. And I don't know what that looks like in terms of medical. I mean, you guys have birthing centers. When I had my daughter and then when I had my son, I reread, Ina May's Guide to Childbirth. Books like that just remind you, we've been doing this for centuries, millennia even. Our bodies were born to do these things. I've seen something, Stu, that you've written about. Having a child should not be a medical procedure. It's a beautiful, natural event. It's not necessarily like something requiring hospitalization.
Yeah, I use the example. It's like breathing or digestion. You don't have to think about it. And only when something goes wrong do you then have to deal with. You get pneumonia or you get colitis, then you go. But every other day. And the same thing with pregnancy. This is a huge issue. We're not going to solve it here, but I like hearing your take on it, because it is a psychological issue that goes on in the hospital. I use this example all the time. A baby's born and finally you cut the cord, and then the baby goes to the warmer, and you ask the nurse, well, why does the baby need to go to the warmer? And the nurse says, well, I have to check the baby out. And you go, well, why do you need to check the baby out? The baby's fine. They're sort of in a hamster wheel. And if somebody like me comes along, or Blyss, or anybody else who comes along and starts to question them, then cognitive dissonance gets in the way. And then they begin to beat on you because you're making them so uncomfortable. You are the bad person. You need to shut up. This is a psychological thing. And obviously, this is your specialty. So it's really hard to change. And the old Japanese proverb about what do you do with the nail that stands out as you pound it back in again.